I was injured at work, and I had hit my tailbone, so I thought that I had just tweaked my tailbone. Nothing could be done for it, so I just continued working. Well, as time rocked on, it continued to get worse and worse until I had to have the ambulance come get me to take me to the hospital.
Elizabeth's case was very unique. She had a large herniated disc and it was severely compressing her spinal nerves. I got a phone call from the emergency room. It was on a Sunday night, and they told me her symptoms. And I immediately knew that this was much more than just your average herniated disc.
He called in his team and he operated on me that night. He was just, it's like, boom. I was so impressed with that.
The procedure that's performed is we make through a small incision. Her situation was much more severe. It was a little larger incision because of that, but still minimally invasive, where we're able to just spread muscle out of the way as opposed to tearing the muscle and tearing tendons and ligaments. When you tear muscle and you strip ligaments, muscle does not heal back together. Muscle scars back together. So your fibers will never sort of regenerate and reconnect. So it's important to preserve muscle function, and that's why we've developed these minimally invasive techniques where we place a tube through the muscle fibers, just spreading the muscle fibers. I'm able to operate through the tube with specialized instruments and microscopes and able to free up the nerves so that they're no longer being pinched or compressed, and take out the disc herniations that are hitting the nerves so that they're not being impinged anymore and the pain and the weakness goes away.
And I woke up the next morning and the pain was gone. I mean, and that was a big thing right there because I couldn't even sit up. It's the little things that you don't even think about, just being able to sit in a chair, just being able to ride in a car, that, you know, now I can do that I couldn't do then.